Tell me about your dry eye story.
So I probably had dry eye since I was 17. I'm now 27, but I've had PRK surgeries done on both eyes in 2015. I didn't know I had dry eye, but thinking back, I've had occasional burning. But 2018 is when my symptoms got very worse, that they were impacting my work day and just my personal life in general. Um, since then, I've tried LipiFlow and IPL and autologous serum and Restasis. Yeah, that's pretty much it. Yeah.
How did the IPL help?
I would say that IPL definitely brought some stability to my symptoms. Before IPL, I could go out, but when there is even the slightest wind would trigger my symptoms, and I just couldn't go out to a beach or go out with friends because this breeze into my eyes would trigger my symptoms. But as the ongoing IPL treatment started, and as we were in the middle of the treatment protocol, I've noticed I could just go out with just my glasses, and I can go for exercise, and I can go to gym and have personal trainer appointments. I can go outside to lunch and dinner with friends. That part of it, I think it did bring some stability to my symptoms.
How long would your symptoms improve for?
They were improved for so it depends. Like when I do my IPL, they really I see the better of it for about 3 to 4 weeks after that, and then after that they gradually start to decline. But after I had my initial set of 6 IPL treatments, the symptoms did reduce, and they've stayed there for about 4 to 5 months. And then I noticed that they've started getting a bit worse, and then we started on another IPL session again. Yeah.
And how's your skin been with all of this?
Yeah, so the very first IPL, I had my cheeks here, this part of my cheeks burn on both sides, and I had just a minor cut that kind of just healed itself in about 24 hours. Just a minor cut, like a nail cutting your skin, like your fingernail cutting your skin. But after that, ever since then, from the first to the rest of the 5 IPL treatments, yeah, the settings on the IPL, Dr. Cremers have increased them progressively, but my skin did not show any signs or any symptoms at all. I never had any burning.
So far, so good. No discoloration.
Yeah. I would say that we have to take we have to be proactive and not go into the sun at least 3 weeks before an IPL treatment. I've always made very conscious efforts to not get out into the sun, and even if I get out, I would just stay in it like 5 minutes and not more than that.
Good.
Yeah, that has really helped with the burning. I just don't feel anything these days when I get an IPL.
Good. How about your screen time use? Has that changed at all, or how?
Yes.
Been managing that?
About 2 years ago, I was working as a computer engineer, and the screen time is usually about 10 to 12 hours. These days, I've really thought, okay, this is not a viable thing anymore. I cannot have IPL on one side and go home and then do more damage again. So I've really cut back on about 4 hours by adjusting job timings. Yeah, my future plans are to just kind of get it back to zero. Just don't use computers for work. Just switching the line of work.
Oh, really?
Yeah.
That's hard to do.
Yeah, I'm doing that.
Oh my goodness. I know I do recommend that, but it's not easy. So thank you for sharing this with me. Is there anything else you want to tell to patients that are concerned about their eyes?
Sure. I would say that when your symptoms are in initial stages, I would suggest that you be aggressive and ask your doctor about new treatments. Just don't wait for it to get worse and start treating it. Just be aggressive up first. up front, that could really help in retarding that progressing of the disease. Yeah.
Thank you. Thank you on behalf of all my patients.